Hi, my name is David Feldman, and I'll be describing something about my practice and of medicine and what I do. So, I am a pediatric orthopedic surgeon. I'm the chief of pediatric orthopedic surgery at NYU Hospital for Joint Diseases in New York City. I specialize and subspecialize, specializing in children's orthopedic surgery and subspecialize in children with scoliosis and severe limb deformities and hip deformities, such as hip dysplasia, avascular necrosis, arthrogryposis, one leg that's longer than the other, one leg that's shorter than the other, and dealing with these different problems. I think medicine today is changing. This is 2013, and we all know that. But actually, the way I practice medicine is the same. I think that's part of the philosophy that I've had for the past 20 years since I've been back at NYU and Hospital for Joint Diseases. I came from Albert Einstein College of Medicine, did my residency at Hospital for Joint Diseases, and then went to do a fellowship at Sick Kids Hospital for Sick Children in Toronto. And since I've been back, I think the most important thing for me in taking care of children with these special needs and these complex problems is really to understand the child, to know the family, and to know the child. So even though today medicine is becoming much more anonymous and much more non-personal, that's not the way I view it. And I think that has allowed me to treat the kids really holistically, being able to treat them from the time they're very young till they're older many times, knowing them, knowing their families for many years, and being able to treat these problems both in a technologically advanced way, but also in a compassionate way where the child is taken into consideration. We can't just fix the leg, we have to fix the child and the family as well, and that becomes really important. It really is important in the way we treat the children from the time they walk into our office to the time they go into the hospital if they need to, and afterwards. And I think that hopefully we show that in the way that we care for children. So what do I do? So mainly the main things that I work on are scoliosis, which is spine deformity, in children who have no other diseases and in children who may have cerebral palsy or may have arthrogryposis or may have familial dysautonomia, all unusual diseases or diseases that can cause scoliosis, or even things like Prader-Willi syndrome that also causes scoliosis, and many other types of processes. I also treat very young children with scoliosis, children who are even born with scoliosis, which is much more rare and called early onset scoliosis. So a big part of my practice, about 40% of it, is dealing with those issues, of dealing with the spine. The other part of my practice is dealing with limb deformities and limb problems. And again, limb problems can occur from a car accident in a child or an adult, or can occur just from birth or developmentally. And so whether it's the hip, the knee, or somewhere in between the foot and the hip, I'm dealing with all types of problems in that area. And we have to lengthen legs and shorten legs, and we put devices on and in. Now we have new devices that can lengthen legs just internally. We have external devices that are computer generated, and we have all kinds of new technologies that allow us to treat these children. But the basic premise of how to treat the child has not changed probably in the last 100 years, is that we have to treat the child as holistically. So I think the devices have changed and they're moving on and moving forward. But realizing that there's a child behind all these problems is the most important part for me. The reason I chose pediatric orthopedic surgery is because, first of all, we're working with children is a gift. There's no secondary gain. If you make them better, they get better. And they just want to go out and play again. They want to go to school. They actually would just like to be as best they can. As well, I get to see the changes over so many years of time. I don't just fix a knee like in some adult surgery and then I never see the person again. I often see children throughout their childhood and even into their adulthood, where I will continue to follow them for problems. So whether it's hip dysplasia, for instance, where we do periacetabular osteotomies, where we can fix the hip, that may be a child I see for 20 years. And I think that to me is very rewarding for children. As well, I get to work in different areas of the body, not just one specific area, although I do limit my practice to lower extremity and spine. And obviously we do some trauma as well for children in all areas. But in complex deformity, I mostly do lower extremity and spine. But I think the gift of working with children and coming to work every day is why I chose to do pediatric orthopedic surgery. So I think that's it in a summary. We'll discuss later, specific diseases such as the ones I'm mentioning, whether it be Perthes disease like avascular necrosis, whether it's an adult or a child, whether it's really a limb deformity that we can correct, or scoliosis. And we'll be discussing those in the future, hopefully, so we can go on and give specifics to children and to parents regarding these diseases and some of these processes and the treatments that we have now for them and some of the things to expect in the future. Hopefully this helped you understand a little bit about our practice, and hopefully I can answer questions for you if you have them.